So I'm Jade Ackers. I'm Programme Director for National Transformation Programme, which focuses on how we can accelerate proven technologies across the NHS that's going to improve productivity and efficiency sustainably. We've actually found about 6 key challenges, and these have been identified through robust discovery work that we did a few years ago, kind of reinforced through user experience, and actually are indicative of the challenges that we're currently facing across the economy and more locally within the NHS. And those key challenges are, there's 6 of them, and they are funding. And we actually recognise there is a lack of kind of dedicated capital and revenue due to competing priorities. So we have, national priorities such as elective waiting lists and reducing the waiting list backlog. We have staff shortages. We have competing digital strategies and digital priorities. And really underpinning all of that is a lack of dedicated technical workforce that exists across the NHS. Another key challenge is resistance to change. So we do know when the adoption of any digital technology that's going to transform the delivery of services, there's always a fear, an inherent fear of change that exists within workforce. And we've found certainly that with automation particularly, there has been a particular fear of job loss that staff have been kind of experiencing, and there's so much that we can do to help to allay those fears that people have got. And also there's just change fatigue. The NHS is particularly going through an awful lot of changes, and so there's a lot of change fatigue that currently exists. Another challenge that we're facing is education. So there's a lack of understanding across organisations and systems of which type of processes can be automated. And I think it's really important that organisations are informed, are educated, are aware, and are able to make the right decisions and informed decisions in terms of which areas to automate first. The fourth challenge is interoperability and data quality. And there's the status of data across the NHS is really variable. And we have an awful lot of unstructured, or what we would call dirty data. And before you can go automating any type of process, it's really important that data is clean and structured. And so there's a great deal of work that organisations need to undertake before they go ahead and automate processes. So the interoperability and data quality elements are really fundamental in the challenges that we're currently experiencing. But many organisations have overcome them, and we can talk about that a bit further on. Collaboration is another challenge, and it's so important that there's a collaboration between the IT departments, the technical expertise, the clinicians and clinical workforce, and the project teams that's needed to deliver successful automation. So without that collaboration, without those important stakeholders engaged collectively in the co-design and co-production of automation transformation, it's going to be really unachievable. The last one is technical. So the technical challenges are real, and they are caused in part by legacy processes, legacy systems that exist, the lack of developers across the NHS to kind of build and maintain processes is really something that I know that many organisations are struggling with. And then you've also got the infrastructure that exists in the NHS too, and the lack of digital technology infrastructure is also a technical challenge that the NHS is facing. And so it's important that those things are recognised as the key challenges. So digital enablement is really important as we focus on the national priorities. So if we look at automation and elective recovery, what's the art of the possible? I think that's the question that we should ask ourselves. And there are so many opportunities within elective recovery and services that sit within that. You can look at referrals and kind of electronic triage and RTT tracking and AI-based e-learning, for example, appointments, and how we can use automation to initiate follow-ups and have kind of clinical auto capacity management. Diagnostics is really important too, as you think about automated remote monitoring, kind of intelligent diagnostics bookings, theatres, looking at theatre capacity, theatre utilisation, and how automation can really help to manage the booking and triage of theatres, and also the readmissions predictive modelling opportunities that exist as well. You can also look at outpatients and kind of referral and appointment management, assessments, discharge processes, and also within elective recovery, the actual patient management processes too. So kind of patient cohorting, diagnostic dependent appointments, deteriorating outpatient trackers, the list goes on. So I think when you look at national priorities, and elective recovery is one that comes first to the forefront of my mind, because it's such an important one in reducing the backlog of patients waiting for elective procedures. That just gives you a feel for the types of opportunities, and they're really big seismic opportunities that exist within that national priority. There's some really good opportunities to take the learnings and recommendations based on organisations' own experience of RPA implementation. I think that it's really important that we showcase the expertise and experience that organisations have been facing with just sharing that, and you know, by for example, sharing case studies or resources that have been created by those teams locally, thinking about also any intelligent automation opportunities or examples that have been created or been thought about within that organisation. So kind of maximising the existing resources and ensuring awareness of communities of practice is really important to improve buy-in. In addition to that, enabling increased productivity and operational efficiencies system-wide is something we absolutely need to do. The future of the NHS is dependent upon us improving the overall productivity and efficiency of the way services are delivered and care is delivered to patients, and staff and patients are experiencing services, and also from a workforce perspective, how we feel in our jobs and how satisfied we are in doing those things without the burden of administration or unnecessary administration. And then the last one I think is really important to kind of influence buy-in is empowering people to learn collaboratively and to share evidence-based recommendations. If we don't continue to showcase the things that have been done really well, showcase the learnings that organisations have and local systems have encountered, and how we overcome those, we won't continue to get the momentum and continue to drive through automation as we have been. There have been a few productivity tools. There's actually a great deal out there in the system, and I've got a couple of examples for you. First one is around reducing admin burden. So speech recognition technologies are really coming to the fore now, and they're so important as as an enabler to reducing the admin burden of kind of updating patient records, for example. And an example I can give you is Worcester. So Worcester Health and Care NHS Trust has been using speech recognition to streamline workflow and reduce pressure on staff. So it's enabling them to free up time for patient care, make better use of existing tools and systems, helping with recruitment, with training, with staff wellbeing and digital culture. Another example I can give you is regarding Mind Matters Surrey NHS, and they've deployed an AI chatbot. So this is another really great example of the early wins that organisations are initiating off of their own organisational priorities. So the Mind Matters AI chatbot has been developed to enhance talking therapies, referral workflow and staff wellbeing. they're having fantastic results there. And another team across Mid Yorkshire Hospitals NHS Trust has been completing a 12-month pilot across 3 hospitals to automate its e-learning process to provide new staff with access to learning as quickly as possible. So they've saved 72% of time taken to register new staff for e-learning. That's phenomenal. That's absolutely phenomenal with a 12-month pilot. And then another example I can give you of really good early wins is regarding the health records team in the Midlands Partnership NHS Trust. They've used RPA to clear the backlog of 40,000 documents, improving document scanning processes, reducing process time by 75%. So we're seeing more and more case studies, more and more examples of best practice across automation, really great transformative processes that are all sustainable, completely different elements and or areas of implementation across organizational usage, and not only confined to back office processes, but also front of house, clinical admin, and really, really important sustainable results. We'd like to move away from rules-based tactical automation to more of an intelligent automation focus. We'd like to focus on digital dictation and natural language processing. I think it's so important that we focus on predictive analysis and image analysis, and use predictive modeling tools to help us to really use unstructured data and get into that dirty data that I talked about before. I think another area that is in the pipeline of opportunity for us that aligns to all of the national priorities is tracking technologies. And this includes eBed management tracking technologies, and they will really play a very important part for command centres, and also more broadly within that kind of solution stack, if you like, is asset tracking. And we know how bigger benefits return that we can also we can realize through asset tracking and inventory tracking and medical devices tracking. In terms of sustainability, we will be able to yield a great deal through asset tracking technologies. So that's just a flavour of some of the different areas that we're looking at. So intelligent automation on the one hand, looking at kind of predictive modelling, image analysis, and natural language processing, digital dictation. They're really important areas for us. And the second one is tracking technologies. That's the second area we're looking at. It's got a great deal of scope, not only within eBed management, but also more broadly within asset tracking. I think with a desire to improve trainee experience and provide flexible working opportunities, I can give you an example of how St Helens and Knowsley Teaching Hospitals NHS Trust has developed a system that empowers staff to quickly and easily pick up shifts from across the region. And it's a really great example of sustainable services. So helping to reduce the number of gaps that would need to be filled ordinarily by costly agency workers. So in their particular case, their aims were to improve trainee experience and provide flexible working opportunities for doctors in training as part of the National Doctors in Training e-learning programme. They wanted to increase the shift fill rates and reduce the agency spend, and also reduce the burden of admin on managerial staff with a digital and fully interoperable solution. So what they did was they created a digital staff bank that transformed workforce management across their region. And the reason I'm giving you this example is because it really highlights the sustainable element of this, and it's something that can be replicated across the NHS. So within the first year for St Helens and Knowsley Trust, the benefits for them included retaining £3.4 million worth of staffing costs, filling more than 33,000 hours of shifts, enabling over 5,500 clinicians to work shifts across 18 trusts, and in enabling 95% of trainees to be accepted in the first 72 hours. These are really important examples of sustainable services and sustainable digital transformation, and automation is a key enabler in that. There are many more case studies that we can share with you that can give you some more opportunities to look at how sustainable digital transformation can be enabled in your local organisation. So I'm going to be discussing intelligent automation technologies and the continuum from where we are now in terms of robotic process automation, and the fact that we have achieved now over 85% of NHS organisations now have automation capability. We now have every single ICS, so all 42 ICSs now have achieved automation capability within their areas. We also have automation capability coverage across every sector in the NHS. So we're at a really good place now to move on from mid to low level complexity robotic process automation into the kind of intelligent automation continuum. So looking at where we are now to where we would love the NHS to get to. So I'm going to be sharing some information with you on that. Let's discuss that at the HETT North show, and that's going to be my focus for discussion at the time.